Hi, I'm Dr. Jameel Smith, Pediatric Psychologist at Wayne Pediatrics, and welcome to this episode of Detroit Peds Talk. According to the Center for Disease Control and Prevention, about 1 in 5 children is considered obese, and childhood obesity remains a serious problem because it can often be a path to health problems as they get into adulthood. And so this makes it difficult for parents to manage because oftentimes when a child's diagnosed with obesity, it requires a whole lifestyle change in the family. And with this being National Diabetes Awareness Month, we thought about, this idea of helping families prevent obesity because one of the potential long-term consequences of obesity can be developing diabetes. And with the holidays upon us and a lot of celebratory eating, we thought that it would be great to equip families with some good things to think about for healthy eating. So with me today is Dr. Colleen Buggs-Saxton, who can help shed light on this issue. Dr. Buggs is a Harvard graduate where she received both her medical and graduate degrees. She also completed her pediatric residency training from Children's Memorial Hospital and Northwestern University Medical School in Chicago, Illinois. She's a board certified pediatric endocrinologist at Wayne Pediatrics, where she specializes in the care of children and adolescents with diabetes and hormonal imbalances, and she's a trusted colleague. So welcome, Dr. Buggs. Thank you for
Thank
being
you.
with us today on Detroit Peds Talk.
Thank you, Dr. Smith.
So, as I noted in the opening, about 1 in 5 children in America is considered obese, according to the Center for Disease Control and Prevention. So first, Dr. Buggs, why don't you define for us what is obesity? When is a child considered obese?
Right. Well, obesity is when you have too much fat, accumulating in your body. And we have to use like objective measurements, to define obesity. So in pediatrics, we rely a lot on growth charts. So unlike adults, obesity is defined by your BMI number. So a BMI of 30 or higher is considered obese as an adult. 25 or higher, 25 to under 30 is overweight for an adult. For a child, we also use the BMI, which is calculated by using your weight and dividing by your height. But we go another step further than just that number. We plot it on the growth chart. So we get a BMI percentile. So a BMI percentile equal to or above the 85th percentile to less than the 95th percentile for a child, and that's based on whether or not male or female and their age, would be considered overweight. If the BMI percentile is at the 95th percentile or greater, that is the definition of obesity for a child. So it's a different chart for a boy than a girl, but it's defined by the BMI percentile.
Okay. And BMI, that's body mass index.
Yes.
And so
Yep.
you kind of graph those numbers on a piece of
Right.
paper to try to help families understand where they are with
Yes.
that number. Okay.
What's nice is that with the electronic medical record, it plots that data. It calculates that automatically when your child comes into the office and their weight and height are measured, it automatically plots it on the appropriate body mass index growth chart for the child.
Okay. And so, when children come in to see the doctor, they can expect to get that information.
And they should ask for it. I really think it's important to share that data with the family. So, as a parent, you should want to see your child's growth chart and have the physician or nurse practitioner, whoever is seeing the child, explain to you, is my child growing appropriately? What's their weight? What's their height? What does that growth chart look like so that you can track that information? From age 2 is when it first starts to calculate the BMI, until age, they become an adult.
Okay. And so, based on what you're seeing in your practice, what are some of those, contributing factors for a diagnosis of obesity in kids?
So the first, contributing factor is really family history. Most obese children, there's going to be one or more parent, who's also obese or overweight. So by and large, it runs in the family for multiple reasons. Um, some other kind of contributing factors that we know are um, factors outside of what we can really control, like where we live, you know, and that's really impacting obesity because it can dictate your access to certain things, right? To certain foods. Is it safe enough for you to exercise or ride your bike outside? What type of environment? Do you live in a house versus an apartment? Do you have access to a backyard? Also your ability to understand how to read and really incorporate health information into your daily life activity. To choose the right foods to eat or other factors. And also access to the healthcare system. Does it make it easy for you to, are you able to make an appointment with your physician or do you always see a nurse practitioner? Not to say there's anything wrong with that, but there are some patients that are moved around to different providers, within a practice and they never can have consistency, right? Where they're reviewing information or someone's tracking something. So that's, all of those are examples of like social determinants of health. Genetics, we talked about, family history, illness and medications. There are some patients who are on medications that make them more prone to gaining weight, like conditions that require chronic steroid use. And then sometimes just certain behaviors like kids, when they're not in school, their whole day is thrown off. So they're sleeping during the day, they're up at night, and they may end up snacking a little bit more than they should be. And of course, diet, you know, um, it's very easy to point out, oh, you have a bad diet. What does that mean? You have a typical American diet, right? All the things that make you more prone to gaining weight, eating the calorie dense food. So those are the major contributing factors to obesity.
Yeah, and I think one of the things that you highlighted in that is some of the things that are outside of a family's control. And so thinking about how to prevent obesity or manage obesity really takes a lot of planning and support for families who
That's,
might be having a child with diagnosed with obesity.
that's right.
And you mentioned how obesity can sometimes be connected to some physical health conditions. What are some of those, that, require certain medications that affect, weight? What are some of those health conditions?
So, in the younger patient population, we do see, particularly in girls and some boys, early puberty, signs of puberty, body odor, hair growth, in the underarm or the private area. As children get older, you begin to see other types of problems with puberty in teenage girls, or, some girls may not have menstrual cycles or those cycles are irregular, or they could have more problems with acne or excessive body hair growth, and that's due to polycystic ovary syndrome. So that is what we see in the population of patients who are obese. The second most common thing is diabetes or prediabetes, So um, these are things, unfortunately, that children have to deal with. This was years ago an predominantly adult disease. And we know in this community about 1 out of 3 or 1 out of 4 children who are diagnosed with diabetes have type 2. And that's directly linked to obesity and other factors like family history. Um, Then, some of the other conditions we'll see are high blood pressure. Some kids have to be put on medication for high blood pressure at a very young age, cholesterol problems, and then what may surprise some individual is sleep disorders. So kids are developing the need to use special machines, CPAP machines, because of sleep apnea. So unfortunately, all of those problems that are listed are problems or conditions that you see in an adult, but because these kids are obese, I think about it like taking a trip, and in that luggage are all these other chronic conditions that that child is now going to have to drag along with them, unfortunately, for the rest of their life if we don't get a handle on this issue now.
Yeah, yeah. And if obesity goes unmanaged, it can lead to some of those conditions you talked about.
Absolutely. And um, it's just hard to explain this to a young child, and they don't really understand. So definitely the diabetes, the hypertension, the irregular cycles. I would say of all the things with obesity, the girls with irregular cycles,
Mm,
the PCOS, that's number one is what I see in prediabetes. Those are the two things, yes.
okay. So, there are a lot of weight management options for adults. What are some treatments available to support families and children who are dealing with obesity?
Yes. So our healthcare system has really come to um, slowly accept that obesity is a chronic condition, and it's really hard for them to get to this point. It was really hard, and even now as healthcare providers and talking even with healthcare teams, like, well, um, why should they be on the medication? And I think what we're all seeing is that you should be able to fix this problem, right? But we know that adults can't fix it. So
Right.
how would you expect a child to fix it? And we also know that there are other parts of the body that doesn't provide the right signal to help slow down the need or that urge to eat, the satiety, your ability to feel full or satisfied, right? So um, there are medications that have been approved for children. The earlier ones had unpleasant side effects, like problems where increased stooling and things like that. So they really were not well received, by children. There's other medication. We use one quite frequently that is used to treat type 2 diabetes, metformin. There's another wonderful medication, but it's injectable that really helps to slow down your need to have this ravenous appetite all the time. Some patients don't want to deal with an injection. It may have side effects. So, and then just recently, there was another medication that came out that's approved. So there are tools. However, the tool by itself is not going to do miracles, right? So you still have to address the underlying issue of making some changes to what you eat and how much you eat.
Yeah. I think you raise this idea that it's a complex, right? It's not just about will
Yes,
or, just stopping yourself from eating certain things. Sometimes there's signals within the body that
right.
aren't firing off in ways that are helpful.
Yeah.
And medication can help with some of that. But then there's other things that we can do with our behavior and our choices that can also work together to support it. What are some things that parents can be doing to help kids overcome obesity from your perspective?
But I think one of the things is recognizing that there's going to be a process, right? So just like it was a process that your child became obese, things are not going to change overnight. They're not going to think like you do. They don't have the maturity, right, to really maybe follow a schedule, or maybe their willpower to make changes are not developed like it's going to be when they become an adult. So the first thing is recognize that the parents have to drive this process, and they drive it by setting examples. You have to be a role model. You have to do like I do, not just what I say, right? So, um, you want your child to eat healthier, you eat healthier, right? It's and eating together, trying to make sure that you eat food, and we use that term loosely, but the majority of what we eat is in a package, is processed. So try to limit the processed foods, right? And eat more of the healthy foods. Like when you go to a grocery store, I tell parents, spend as much time as you want in the perimeter of the stores with the fruits, the vegetables, the dairy, the meat, right? Be very selective what rows you go down in the middle of the store. If you want bread, just go to the bread aisle. If you need cereal, go there. But just don't walk up and down the aisle. I think the other thing is eliminating sugary beverages. So if I had to give two things, eliminating sugary beverages and decreasing portions. Okay, and not going back for seconds. Decreasing the portions. Watch what you drink and do some activity.
Yeah.
Don't tell them to exercise, do something with them.
Right, right. Make it a family
Yeah,
plan and a family attack to live in a healthy way. Um, well, I'm so grateful for your perspective. Obesity can be a really socially significant and complex issue. There's this whole concept around the ideal body, and that makes it even more difficult when thinking about, is obesity really an issue? If a certain body type is celebrated in a culture. But ultimately, we want to protect and provide as much support as we can for children and families that are facing and trying to manage obesity. As a pediatric psychologist, I see a lot of issues that can come up when kids are faced with
absolutely.
obesity.
Yeah,
The bullying,
yes,
um, being stigmatized amongst their peers,
yes,
depression, even emotional eating, right? So we can get into some of this disordered eating that can arise.
absolutely.
Um, and so, as you say, choosing healthy foods. And listen, we live in a time where food insecurity or just buying groceries can be
Yes,
really expensive.
right.
So, making a list ahead of time can also be helpful. Planning meals, if you can shop within a 2-week time frame and think ahead about what the meals are going to be for the family, that can really cut down on the snacking and the packaged consumption.
Right.
um, Low cost food items like beans and peas and, a mix of fresh and frozen
Absolutely.
vegetables that can keep over time can help with, some of the real limitations that some of our families have around securing healthy food. You talked about regular physical activity, limiting screen time, because when we're watching our screens where our bodies are inactive. And
Right.
so even if it's getting the blood going by cleaning or moving things around at home or picking things off YouTube that are exercise, just to get the blood going, not to run a marathon. All of these things can help us be active when our choices are limited. And then again, as you say, mirroring healthy habits, right?
Yeah,
So kids are going to do as we do, not as we say.
absolutely.
So
Yeah.
that's really important.
Yeah. And
Well,
also just making it like um with the screen time and exercise, dancing. We love to dance, and so just have fun with it. Enjoy food. I'm not saying don't eat sweets, but don't overindulge. You've got to make changes to see changes.
yeah, yeah, and yeah, and the more you can have a plan
Yes,
ahead of time, the less you're likely to be impulsive with the kinds of things that you might consume.
absolutely.
Yeah.
Yes.
Well, I want to thank Dr. Buggs for joining me for this episode of Detroit Peds Talk to discuss this important issue of obesity in children. For more information about Wayne Pediatrics, please visit waynepediatrics.org. And you can follow us on Instagram and Facebook for new episodes of Detroit Peds Talk. And remember, pediatricians are the best option for the medical needs of children. Take care.
Thank you, Dr. Seth.